Good day, Trinidad and Tobago. You have just tuned in to one of the most accurate and up to date sources of information on the national COVID 19 response, and that's the Ministry of Health's COVID 19 conference. Let me introduce our panelists this morning: the Honorable Terence Deyalsingh, Minister of Health. Dr. Miriam Richards, Principal Medical Officer of Institutions at the Ministry, and Dr. Sana Mohammed, Pulmonologist and COVID 19 Consultant with the North Central Regional Health Authority, and Candice Alcantara, your moderator this morning. And just to give you a little information, we'll have a slightly different structure for the conference this morning because we have two very important topics to discuss: COVID 19 and influenza, and yes, they are related. So we'll actually have two short segments of Q&As in between the presentations. And we will start now with the presentation from Dr. Richards. She will give us some up-to-date clinical information.
Thank you very much, Candice. Honorable Minister, Dr. Mohammed, my colleague, members of the media, members of the viewing and listening public, and persons who've been tuning into this broadcast internationally, regionally, and locally. Good morning. Thank you very much again for joining us at our press conference. This morning, I'd like to present two pertinent areas of information. Firstly, I'd like to speak about the clinical update, number 885 as of 4 p.m. on October 22nd. And secondly, the status of the hospitals in the parallel healthcare system, with an emphasis on the ICU levels. As of 4 p.m. on the 22nd of October, there were an additional 322 confirmed cases of COVID-19. This has increased the rolling average to 216. The total number of active positive cases is now 4,511. And at present, these cases are distributed as follows: 34 patients at step-down facilities who are recovering from COVID-19, 297 patients in hospital, and 3,858 persons in home isolation being monitored by the relevant county medical officers of health. At this point in time, there were 4 additional deaths, taking the total number of deaths to 1,633. And the Ministry of Health team would like to express our sincere condolences to the family members of the deceased. The Honorable Minister will provide information on the vaccination drive, and now I'd like to provide some information on the status of the parallel healthcare system. This morning, the parallel healthcare system has an overall occupancy of 34%, and this occupancy level has been consistently under 40% for the past 99 days. However, we continue to notice a trend of increasing ICU occupancy even during this time. Now, it's important for everyone to note that we continue to plateau under 40%, and we are doing this in light of restrictions imposed by the state of emergency. Of course, restrictions are being relaxed to allow further movement of persons, and we now have 102 confirmed cases of the Delta variant. The ICU occupancy over the last week has been increasing, and this has been noted on a daily basis from last week Saturday to present. Yesterday, at a meeting with all medical chiefs of staff from the traditional and the parallel healthcare system, we confirmed that there has been an increasing number of severely and critically ill patients presenting to the accident and emergency. So persons are currently coming into the accident and emergency very ill, requiring oxygen, requiring dialysis, requiring intensive nursing, and in many cases they are too ill to even be transported to the parallel healthcare system. We are urging members of the population that if you or your relatives are confirmed COVID positive and you are noticing declining clinical symptoms and signs, if you notice that they are becoming out of breath, their blood pressure is decreasing, their oxygen saturations using the pulse oximeters that the county medical officer provides is decreasing, please contact the 811 service in the JMRTT and let's get them to the accident and emergency very quickly. We've also noticed that with this wave, or this third wave of the COVID-19, that persons are presenting in a much more ill state. And of course, with the Delta variant and the increased transmissibility and severity of the disease, this trend was expected. Our accident and emergency doctors and our doctors at the Parallel Healthcare Facility this morning reported that the majority of beds at each of our hospitals in the ICU department were filled. Now, the Ministry of Health is trying our utmost best to ensure an appropriate quality of treatment in line with international standards for all COVID-19 patients. And we have noted that despite a 25% phased increase in the number of ICU beds that have been operationalized over the last month, these beds continue to be filled. Again, I'd like to remind everyone that a bed is not a bed. And at this point in time, we require additional resources as we try to ramp up beds. The occupancy continues to be trending upwards, both in Trinidad and Tobago, with respect to ICU occupancies. I'd like to now provide some up-to-date information regarding the vaccination status of hospitalized patients. And for this, I'd like to switch to a previous slide that was aired, really to impress upon the population the importance of vaccination. So between July 22nd to October 6th, 2021, 437 patients were admitted into the parallel healthcare system. Of those, 4,178 were not fully vaccinated. So that's 94.2%. 9 out of 10 patients into the parallel healthcare system are not fully vaccinated. Ladies and gentlemen, the Ministry of Health continues to do all in our power to ensure that lives are saved through the parallel healthcare system and the traditional healthcare system. This morning, I'm appealing to you on behalf of all those medical chiefs of staff, of every volunteer from the private and public sector who has assisted in the vaccination drive, and all other stakeholders. Vaccination is your civic, social, and personal responsibility. Please, we have done our part with respect, and we continue to do our part with respect to increasing the number of beds, which is, of course, limited by resources, by providing health care for all persons in our population. However, you need to do your part. So please, vaccinate and don't delay. Thank you very much, Candice.
Thank you very much, Dr. Richards. And now we go to the COVID-focused presentation from the Honorable Terence Dayal Singh, Minister of Health.
Thank you very much, Candice. Good morning to Dr. Richards. Good morning to Dr. Mohammed. Ladies and gentlemen of the media, the viewing and listening public, wherever you are. This morning, Trinidad and Tobago, we are reaching a very dangerous juncture in our fight against COVID-19. The danger that we are facing is what Dr. Richards and Dr. Trotman started to talk to the country about over a month ago. You may recall Dr. Trotman over a month ago at a press conference at the Diplomatic Center spoke to the fact that our ICU HDU capacity is limited, and that if patients present needing that advanced level of care, they may have to triage patients. And that's not a good thing, because it means the doctors will have to determine if you have 10 persons who need ICU or HDU care and you only have 5 of those beds available, which 5 will get it. This point of danger has been exacerbated in the past week, where our vaccination rates have plummeted by about 55%. You may recall at last week's press conference at the Diplomatic Center, I said at that time, between first dose of a 2-dose regime and the Johnson & Johnson one shot and done, we were averaging roughly 3,000. I think the exact figure was 2,939 a day, which was a improvement prior to the Monday 11th October figures, which were also low. In the past week, we have been averaging 1,614 shots as compared to the previous 3 weeks of 2,939. So our vaccination rates have plummeted dangerously by about 55%. And I am using the word danger this morning deliberately. No pun intended, we need to inject a sense of urgency again into our population to get vaccinated, because the level of care at the ICU and HDU setting that the unvaccinated will expect may not be there. I want to refer again to the example of Grenada, which we spoke about at the Honorable Prime Minister's press conference over a month ago, where they introduced a system called a medical ethics system to determine who gets that level of care. I want to quote from today an article in the newspaper. St. Vincent Health Minister urges population to get vaccinated. And I want to quote, he says, and this is the Minister of Health in St. Vincent, the Honorable St. Clair Prince. He said, so far, though stretched, the system has been able to cope as we already have put certain measures in place in anticipation of a surge. Sounds familiar to what we are doing here. But the article goes on to say, Prince, that is the Honorable Minister of Health, told reporters, this does not mean that the danger of being overwhelmed is not real. Ladies and gentlemen, this is what healthcare systems around the world are being faced with now. Making decisions as to who gets a certain level of care among the unvaccinated. I would like to draw your attention to another example coming out of the United States. There was a fervent anti-vaxxer, 40-year-old in the United States, who presented at a hospital. And while he was being treated and being determined whether he needed ICU care or not, the doctor told him, he said, sir, you are here unvaccinated, of your own choice, but downstairs there's a 10-year-old boy who is involved in a serious vehicular accident, needing an ICU bed, and I have one. And he asked the man, if you were in my place as a doctor, you have a unvaccinated 40-year-old out of his own choice versus a 10-year-old child in a vehicular accident, both vying for that same last ICU space. How do we make that decision? Ladies and gentlemen, we are reaching that point in Trinidad and Tobago that we have been advising, warning the population for months now. You have heard the statistics that Dr. Richards has given. They are not good statistics. What is our vaccination picture to date? Could I have the first slide, please? To date, we have vaccinated with first dose 617,429, and completed vaccination schedule, whether it's 2 doses of a 2-dose regime or 1 dose of the 1 shot and done, 583,447. As we always say with these figures, there are another 300,000 persons who are eligible to be vaccinated. And we are now crawling at 1,614 a day. If we do the math, it will take us very, very long to vaccinate those persons who are making a deliberate choice not to be vaccinated. And my advice / warning to those today, again, is that the level of care you may need may not be available in the near future. Next slide, please. This is where we are graphically. Same sort of figures. Could I have the next slide, please? From next weekend, in an effort to bring more people to vaccination sites, next week, Friday and Saturday, we are launching National Care Fairs. A healthier you starts here. 6 sites across Trinidad and Tobago, 5 in Trinidad, 1 in Tobago, where we are inviting people. It's not a vaccination drive. It's an attempt to get people to understand that these comorbidities we talk about, diabetes, blood pressure, cancer, we are going to be having free screening, free consultation. It's a whole wellness approach. And we are doing this in conjunction with the IDB, the Trinidad and Tobago Medical Association, the Trinidad and Tobago NCD Alliance, Ministry of Communications, Ministry of Health, Ministry of Youth Development and National Service, Division of Wellness in Tobago, the THA. It's a whole of government, whole of society approach, all the RHAs together. So next week, Friday and Saturday, we ask you to come out to these events at these sites to get screened for your diabetes, your high blood pressure, your cancers, and so on. And let us get vaccinated. This is how we are evolving in our response to encourage people to give them the information that they need to get vaccinated. So those are my comments this morning. I just want to reiterate, ladies and gentlemen, that we are in a dangerous place now. As we predicted, that the persons who are largely unvaccinated, you saw the figures, 94.2% of them make up our patients in the parallel healthcare system. Just get vaccinated, protect yourselves from death, protect yourself from serious illness, and help us protect our ICU space to those who really, really need it. Thank you very much, Candice.
Thank you very much, Minister Dayal Singh, and some very important points there this morning. And of course, we have the National Care Fair 2021 coming up. And as I indicated when we started, that we have a different structure this morning to the conference. And so now we go into the first Q&A segment. We begin with questions from Guardian Media Limited this morning.
Hi, morning everyone. Rashad Khan, Guardian Media Limited. Okay, so my first question would be to Dr. Richards. Dr. Richards, now a number of those 102 Delta cases that we've heard about recently, they have been vaccinated, right? Fully vaccinated. But what has the symptomatology been with the fully vaccinated cohort versus those who weren't vaccinated at all? Do we have that kind of information? And my second question, Minister Dayal Singh, we see that now school children are going to be brought out, whether vaccinated or unvaccinated, when that population or that cohort of students are only about 50% vaccinated. Is there a possibility that a similar approach would be applied to the Safe Zone initiative? Thank you.
Good morning, and thank you, Rashad, for that question. The clinical features and clinical patterns of the vaccinated confirmed Delta cases mirrors that of what we've noted in the population. That is, these confirmed cases tend to have very mild symptoms and can be managed through isolation at the relevant facilities in the parallel healthcare system. We want to reiterate that vaccination also reduces the risk of transmissibility of the Delta variant and reduces your risk of being hospitalized and especially requiring ICU and HDU level care. So yet again, we have been noting the clinical evidence that vaccinated persons who acquire the Delta variant have mild or asymptomatic symptoms and recover. Thank you very much.
Yes, thank you, Richard, for your second question about school children coming out who are unvaccinated versus the safe zone principles. So let's go back to the safe zone principles. The safe zone principles is to create an environment for social gathering, for businesses to continue to operate, to create employment, to make sure people can put food on the table, pay their rent, and so on. The safe zone principle is one base where people are going to have to take off their masks to be in that safe zone for eating, for drinking, for socializing. So the principles of the safe zone are different to what is happening with schools now with Forms 4, 5, and 6. Forms 4, 5, and 6, bringing out children, in my view, I think the Minister of Education has done the correct thing because this is about total child development. Bearing in mind that the public health measures of masking are going to be in place as opposed to a safe zone where you have to take off your mask to socialize, to eat and drink, and so on. So the two main takeaway points from the school initiative, which we support, is one, and the safe zone. We have to learn to live with this virus. We cannot be retreating from this virus every single day because the economy will collapse. You have heard the Minister of Education speak about the learning gap. All of these things have to be taken into consideration. And what I would advise parents to do, I brought my old vaccination card here this morning. When I had to go back into the Faculty of Medical Sciences in 2007, if I wanted to be a part of that faculty in 2007, I had to be vaccinated for Hep B, which I got. I had to have a TB test, which I got. My glasses are fogging up here, which I got. I also had to redo mumps, measles, and rubella, yellow fever. So to be a part of this system, I am urging all those parents of children of Forms 4, 5, and 6, and even those from Form 1, every child over 12 who is vaccinatable, please do your child a favor by protecting them now by getting them vaccinated. The same way you vaccinated them from ages 6 months against all childhood diseases, now they are in this adolescent stage of their lives and we want them to go back to school. The simple message is get them vaccinated. Thank you, Richard. That was an excellent question.
Thank you very much, Minister. And I see that AZP News is back on and they indicated that they had questions previously. So let's go to AZP News at this time, please.
Good morning. This is Suan Wayo from AZPnews.com. And to the Minister, with respect to safe zones, some persons are asking in terms of street food, like doubles, that you have a pie on the side of the road. Will that be allowed at any point in time soon? And with respect to the influenza, I don't know if maybe later on you all might open the panel for that. But if you have a COVID-19 vaccine, should you still get an influenza vaccine? And if so, how long after being vaccinated from COVID-19? Thank you very much.
Thank you very much, Suan. And you raised two important issues. So we'll deal with them. So the issue of street food, eating street food, which I like, doubles and gyros and all those things, is still not allowable under the regulations, I believe. And the issue of flu vaccines, yes, let's deal with that because I don't want to confuse the flu vaccine issue with the COVID vaccine issue. So let's deal with COVID. And after we deal with COVID, your answer is a very relevant one and we have the answer. We'll deal with it then.
Thank you very much, AZP. We'll address your question in the second Q&A. We go to TV6 now, please. Hi, good morning, TV6.
Morning. Just wondering, in terms of the issue of the public service, there was this discussion, of course, about a workplace policy where vaccination is concerned. Could you give any more information in terms of that aspect as the more aspects of the economy are now opening back up? And also in terms of the safe zones as well, how has the government been treating with businesses that have opted not to participate because it's voluntary, as you had said. Were you expecting more businesses to participate? And is that part of any conversation going forward in terms of how you deal with the issue of living with the virus, as you said?
Thank you. Thank you, Joel. So, part one, well, your first question about the workplace policy, I would advise that we direct that question to the Honorable Stephen McClatchy, the Minister of Labour. But there is no policy that says that public servants have to be vaccinated to come out to work, but we are reaching out to them. On the issue of the safe zones, so the safe zones is a voluntary policy. We urge as many businesses as possible who have the wherewithal to sign on to it, to sign on to the safe zone policy, so that that type of business could continue to exist profitably for the business owners, and that people who need that sort of release for social engagement can do so in a safe setting. Some businesses have decided to operate simply outside of the safe zone policy, which is their prerogative, and to do grab and go, to do takeout. I have been talking to several restaurant owners, just a couple of, so this is anecdotal evidence, and they are saying that their takeout business now, which has picked up outside of the safe zone policy, is around 60, 75, 80% of what they will normally do with full dining. So individual businesses will be making their decisions. And what I am pleased to see is that those who have opted to go into the safe zone mode are really doing well. So it's a personal decision that businesses will have to make.
Thank you very much, Minister. And we will take in this Q&A segment, as I said, we have another coming up. We will take the final in this segment from Newsday.
No problem.
Are we ready with question from Newsday?
Yes, good morning. Janelle D'Souza from Newsday. The first question, Dr. Abdul Richards, you said that from over the last week, number of ICU cases have been increasing daily. Can we get a number on that? And as well, Minister, the National Care Fairs, I've already gotten questions as to whether those who are already vaccinated could come and get screening as well.
Okay, so I will take the second question first, and then we go to Dr. Yeah, so I'm glad you raised that. The National Care Fair is open to anybody. Sorry, the National Care Fair is open to anybody, vaccinated, unvaccinated. Come and get advice on your hypertension, your diabetes. Get screened. Because if you would remember, and this is an important point, many people are presenting to the hospital system with COVID not knowing their health status. Dr. Trotman would have said that people only realize they are hypertensive or diabetic when they get COVID, and then we test the whole panel of tests. So yes, anybody could come in. Any age group, vaccinated, unvaccinated, we are here to screen. And if you decide to get vaccinated on the spot, you can get vaccinated. Plus, you will get the information that you need to make an informed choice to get vaccinated at a later date. So it's a whole holistic thing that we are doing. And let me call out the centers. I'm glad you asked. It will be the Paddock at Port of Spain, which is already a MassVac site. It will be converted this week into that. Costat El Dorado, which is already a MassVac site. Sangre Grande Civic Center, already a MassVac site. UTT Monroe Road, already a MassVac site. Sapa San Fernando, and Lowlands Mall Tobago. So it's a national drive to target and tackle the issue of NCDs. If you know you are diabetic and you want further information, come in. If you are not sure of your health status, come in so we can guide you. And if you choose to get vaccinated on that day, you can get vaccinated. Thank you very much.
Thank you very much, Ms. D'Souza, for your question. On average, we have been seeing the demand for ICU beds of approximately 5 patients across the RHAs per day. This means that every day across the traditional RHAs, for example, Port of Spain General, the Eric Williams Medical Sciences Complex, ARIMA, San Fernando, we are seeing approximately 5, and on some days we saw 7 to 8 patients who required transfer into the parallel healthcare system. These patients are being treated in the accident and emergency departments, for example, at Mount Hope with ventilators. We noted 5 patients on one given day at the Sandy Grande Hospital Accident and Emergency. So the demand for ICU beds is increasing. And yes, we did increase the number of beds in the parallel healthcare system by 25% in preparedness for Delta. But we will reach a stage eventually where the resources required to staff these beds, that is, a bed is not a bed, will be limited and will not be there. So as Minister said, persons requiring an ICU bed for non-COVID reasons may be unable to obtain that bed. So yet again, let's do our part and please vaccinate. Remember that 94.2% number that I gave earlier. Thank you.
I just want to comment here. There's another subpopulation, another subgroup that we are concerned about with the low vaccination rate, and that is our pregnant population. WHO, Dr. Ade Sirji Singh, everyone they have put out a clarion call for the pregnant population to be vaccinated. Since we took the decision to vaccinate the pregnant population, only about 800 persons, pregnant women, have in fact come forward to be vaccinated. We again urge the pregnant population, and we are going to speak to them soon about flu vaccination, because they are also susceptible to not having a good outcome if they get influenza. So again, we appeal to the pregnant population to get vaccinated against COVID-19, and then we'll have a separate conversation about getting vaccinated and how and when do you wait about the influenza vaccine. Thank you.
Thank you very much, Minister. And now we go to focus on influenza. As you know, recently, the Ministry of Health began the rollout of the new influenza or flu vaccination program. And so we have with us Dr. Mohammed, who will give us some information and highlight the importance of getting the flu vaccine.
Good morning, everyone. Thank you, Ms. Alcantara. The Honorable Minister Dayal Singh, Minister of Health, Dr. Miriam Abdul Richards, Principal Medical Officer, Ministry of Health, members of the media, and members of the listening and viewing public. Today, I have the pleasure of speaking to you about influenza. Most of us have heard about influenza, which is more commonly called the flu. And influenza is caused by a group of viruses, influenza virus, and it is a contagious respiratory illness that occurs and causes outbreaks and epidemics worldwide, mainly during the winter months. These viruses infect the nose, throat, and sometimes the lungs. Influenza virus spreads mainly by tiny droplets made when people with flu cough, sneeze, or speak. These droplets then can land into the mouths or noses of people who are nearby. Less often, a person might get influenza by coming into contact with droplets on a surface that they touch and then touching their own mouth or nose. What's important is that you're able to pass on influenza to someone else even before you know that you are sick. But this is less common. More commonly, influenza is most contagious after 3 to 4 days of symptoms. So what are the symptoms of influenza? Well, people with flu often experience fever, cough, fatigue and tiredness, headaches, body pains, runny nose or stuffy nose, and vomiting and diarrhea, although this is more common in kids. Influenza can cause mild to severe illness and at times can lead to complications, including hospitalization and sometimes death. So on my first slide, we'll talk a bit more about the common cold. So influenza and the common cold are both similar in that they are contagious respiratory illnesses, but they are caused by different viruses. Flu is caused by influenza viruses only. But the common cold can be caused by a number of different viruses, including rhinovirus, parainfluenza, and seasonal coronaviruses. Because flu and the common cold have similar symptoms, it can at times be very difficult to differentiate them based on symptoms alone. But in general, flu is worse than the common colds, and symptoms are typically more intense and begin more abruptly. Persons with the cold are more likely to have runny or stuffy nose than persons with flu. What is most important is that the common cold generally does not result in serious health problems such as pneumonia, bacterial infections, or hospitalizations. But as we've said before, flu can have serious associated complications. Pneumonia is the most common complication of influenza, but other complications including muscle involvement and involvement of the central nervous system can occur. Complications of flu usually require hospitalization, and in some cases that has been reported. Locally, we've experienced the H1N1 or influenza A 2009 pandemic, and we continue to experience flu cases yearly. In 2019, that's about 2 years ago, the Ministry of Health reported at least 40 flu-related deaths for that year's flu season. May I have my other slide, please? So who's at risk? So there are groups of persons that are high risk for complications of influenza. And this slide is taken from the CDC, and they've identified groups that are at higher risk. And these include adults 65 years or older, children less than 2 years, persons with comorbidities including asthma, blood disorders, chronic lung diseases, heart diseases, kidney diseases, liver diseases, metabolic disorders including diabetes, people who are immunosuppressed, persons who live in long-term care facilities, and pregnant people and persons up to 2 weeks postpartum. So because of how contagious the flu is, precautionary measures should be taken to limit transmission. These include covering your mouth and nose with a tissue when coughing, and then discarding said tissue, washing hands regularly and thoroughly, and avoiding touching your eyes, nose, and mouth. Cleaning and disinfecting surfaces and objects that may be contaminated, and avoiding close contact with ill persons are also important. All these public health measures should be second nature to us during this COVID pandemic. Now, if I could leave you with just one message today, it would be that the best way to avoid getting flu is to have your annual flu shot. The CDC recommends that all persons, and our Ministry of Health recommends that all persons over the age of 6 months have their annual flu shot. The vaccination has also been shown to decrease the severity of flu, to decrease hospitalizations, and in the case of children, to decrease the risk of flu-related death. So we're very lucky that the Ministry of Health have made the flu vaccine available through health centers, particularly for those groups of persons that we've identified as high risk. Ideally, persons should get vaccinated at the start of the flu season for most effective coverage, but getting vaccinated at any time during the influenza season still offers protection. So I would therefore urge you to take this opportunity to get vaccinated with your annual flu shot, especially if you are in a high-risk group. Remember, it's also your responsibility to encourage your friends, your families, and your colleagues to do the same. Getting vaccinated with your flu shot can protect you as well as your loved ones. Thank you for your attentiveness.
Thank you very much, Dr. Mohammed. Very, very educational. And I know that people are going to go out now and get their flu vaccine. And we have some statements now from Minister Dayal again, but now as it relates to influenza.
Thank you, Candice, and we'll be answering Suan's question during this part. So, traditionally, and this year is no different, the influenza season runs from October of any year, so we are in October 2021, to May of the following year. So this year's flu season is from October 21 to May 2022. That's a typical flu season for this part of the world. The persons and the subpopulations we like to get vaccinated are always, and they have remained the same. 1, healthcare workers, our doctors and nurses, anybody involved in close contact with members of the public, our patient care assistants, our lab techs, and so on. So healthcare workers. 2, we also always go after our pregnant population because pregnancy decreases your ability to fight the influenza. 3, those over 60, especially those with non-communicable diseases. So next week's Care Fair, we will have the influenza vaccines there made available for persons over 60 with NCDs. As Dr. Mohammed said, children over 6 months get vaccinated. We also advise that persons who are immunocompromised, example, those with lupus, cancer patients, get vaccinated. You will notice it follows the same pattern for those with COVID-19. It's a respiratory disease. Persons with chronic respiratory illnesses, example, asthma, COPD, chronic obstructive pulmonary disease. Maybe Dr. Mohammed can speak about that. We ask again, frontline workers, TTPS, police, everybody in the protective services, customs, immigration, all these frontline workers, sanitation workers, get your flu vaccines. The flu vaccine is currently available in all our health centers, 109 health centers throughout Trinidad and Tobago. And now to specifically answer Suan's question from AZP News, the time frame between COVID vaccines and flu vaccines. So, it's a 2-week window. What do I mean? If you plan to get your COVID vaccine and you get your influenza vaccine today, wait 2 weeks before starting your COVID vaccine regime. 2 weeks. If you have already had your COVID-19 vaccine, then you wait 2 weeks again after you have completed your final COVID dose. So, if you are taking your 2-dose COVID-19 vaccine regime and your second dose is today, you wait 2 weeks before taking your influenza vaccine. If you take your 1-dose J&J, 1 shot and done today, you again wait 2 weeks after. So a 2-week rule, either before or after. It's that simple. So I am going to be vaccinated live. That's why I came in short sleeves today by Nurse Grace Sukchan. My last, my COVID-19 regime, if I go back to my vaccination card here, I would have gotten my second dose on the 7th of July. So I am way past 2 weeks. So we advise everyone, if you have received your COVID-19 vaccine, 2 weeks and more, you are now a good candidate for receiving your flu vaccine. And let me repeat. If you are thinking about being vaccinated for either COVID or flu, if you get your flu vaccine today, you wait 2 weeks before getting your COVID-19 shot. So we do have some time for questions, Candice, while Nurse Grace Sukchan prepares to vaccinate me.
Okay, great. Thank you very much, Minister. And so we got a response to the question from AZP News. So we will go back now to a question from Guardian Media Limited, please.
Good morning again. Okay, I don't know who would be best fit to answer this question, but I know Dr. Mohammed there mentioned that in, I believe it was 2019, we had about 40 flu-related deaths. What were the flu-related deaths like for the years during the pandemic? And I assume it was going to be a lot less, given that the COVID protocols also helps protect against influenza. But with that also being said, how has that lower incidence of influenza because of COVID protocols influenced our procurement of flu vaccines?
Thank you, Richard. So I have that data here. So I'm going to go through the data from 2018 to 2021. In 2018, the number of reported influenza cases was 4,598. there were 7 deaths. 2019, 3,854 reported suspected cases, 44 deaths. 2020, number of reported cases, 858, no deaths. 2021, the year of the pandemic, and you are so right, Rashad, and the CMO would have mentioned this, because of the health protocols of wearing masks and cleanliness and so on, we had dropped our 115 suspected cases, and we had no deaths. What is instructive now is also the number of flu vaccines we gave out. In 2018-2019, we gave out 55,221. Last year, year before, 2019-2020, we gave out 118,015. And last year, the year of the pandemic, 2020-2021, we gave out 75,887. So that is the complete breakdown of statistics, number of reported. What is interesting, Rashad, because you asked a very good question. In 2018, the number of suspected cases, 4,598. But look at last year. It dropped to 115. Work out that percentage. Why? Because of all the protocols. We were not congregating. We were masking. We were sanitizing. But this year, as the coronavirus is there, the borders are now open. Remember last year, borders were relatively closed. So people are traveling to North America and coming back here. And we always follow what has happened in North America because that is one of our sources of the influenza vaccine. So let's hope we maintain 115, but we doubt it very much. But what we want to keep at 0 is the number of deaths. We have had 0 deaths for the past 2 years. If we could vaccinate people against influenza now, we could keep that down to 0. Okay? Thank you very much.
Thank you very much, Minister Dayal Singh. And now questions from TV6, please.
Just wondering, Minister, in terms of the issue of adverse effects, let's say a person who has taken the COVID vaccine and then takes the flu vaccine or vice versa, any data to show that there could be any concern in that regard? And also, what would be the government's position on the issue of managing the COVID response during the flu season?
Yeah, thanks. So WHO has published some information about the co-administration of influenza vaccine and COVID vaccines at the same time. So in other words, you go to a center, you get influenza vaccine in one arm, and you get COVID vaccine in another arm at the same time. In that limited cohort, they have found absolutely no increase in either side effects or adverse events. However, we are being a little more cautious. We are not advising the co-administration of both vaccines at the same time. We are advising a 2-week gap to ensure that we are protecting the population as far as possible so that confidence in the government's vaccination program, now that we are adding the flu vaccine on top of the COVID vaccine, can be maintained. We have been a little bit cautious, but I think the cautious approach has worked for us over the past year and a half. Thank you, Joel.
Thank you very much. And we go now to AZP News.
Good morning again. Can you provide us with a cost of the influenza vaccines and where they were sourced from, if it can be disclosed, please? Thank you very much.
What the cost? Okay, thank you. So traditionally, and this year is no different, we always procure our influenza vaccines via PAHO, and this year is no different. So we always go through PAHO and the revolving fund. The cost of these vaccines is roughly about $5 US, $5.80 80 US per shot, I'm being told by Grace off camera here. So, two good questions. We always get our influenza vaccines through PAHO. This year, no different. What is different this year is that we are getting a quadrivalent vaccine. What does that mean? In years gone by, we would have gotten a trivalent vaccine. That is, a vaccine tri-3 that was effective against 2 strains of influenza A and 1 strain of influenza B. This year, we are introducing a quadrivalent vaccine, Quad 4. It's effective against 2 strains of influenza A and now 2 strains of influenza B. Thank you very much.
Thank you very much. And do I see another question from TV6? Yes, let's go to TV6. Go ahead, TV6, and we are hearing you.
The conversation about whether or not there will be booster doses of the COVID vaccine in light of the government's position now in terms of encouraging people to get the flu vaccine, how does that factor into any potential booster vaccines where COVID-19 is concerned?
Sure. So, Joel, it's nice to see that you are covering something non-political. you are becoming expert in health. Excellent. Yeah. So, good question. The issue of, and I think there is some, the word isn't miscommunication. I think the word that we need to be using is not really a booster shot. It's either a third dose or a second dose. What WHO is considering, what the FDA is considering, is if you have a 2-dose vaccine, adding a third dose to it, and if you are taking a 1-dose vaccine, adding a second dose to it. Maybe booster is not the correct term to use. It's either a third shot or a second shot. WHO is monitoring the developments around the world, whether those developments are coming out of China with Sinopharm, the UAE, the United States FDA. So it's being called a third primary shot, not really a booster shot. The US FDA will be meeting to look at some data being presented by Pfizer next week. So the jury, whilst not entirely out, the jury members are coming back in one by one. WHO has 2 candidates before it for other primary shots, Sinopharm and Pfizer, but no firm decision has been made. But what will happen is that hopefully that same 2-week separated window will apply. Okay, Joel?
Thank you very much, Minister. And as mentioned earlier, we will have live vaccination on the conference this morning. And I welcome now my colleague, Nurse Grace Sukchan, who is the manager of our expanded program on immunization. As she comes forward and she sets up, we'll just recap some of the important points that were raised today. We know that, we are continuing to push COVID-19 vaccination. Please do your part and protect yourself and your loved ones. If you have not received your COVID-19 vaccine as yet, we encourage you to come forward. And we also raised this morning flu vaccines, and we'll see Minister get his vaccine in a very short space of time. Flu vaccines are as important. We have some high-risk persons who are at high risk, and symptoms are very similar. So we really encourage those of you who have not received your COVID-19 vaccine, have your COVID-19 vaccine, and you can wait 2 weeks after the final dose of your COVID-19 vaccine. And one other important point raised today was the National Care Fair. We are going now to focus not just on COVID-19 vaccine and flu vaccine, but on overall wellness. So we encourage you to come out, bring your family on Friday the 29th and Saturday the 30th of October from 9 a.m. to 3 p.m. Come out to the Paddock, Queen's Park, Savannah, Costart, El Dorado, Sangre Grande Civic Center, UTT Monroe Road, Sapa San Fernando, and Lowlands Mall, Tobago. You can get free screening, your blood sugar, blood pressure, free health consultations, and of course, you can get your vaccine there. So we go now to the end of the conference. We go to the vaccination of the Minister of Health.
Okay.
And so, Minister, I'll just turn a bit. So I think Ms. Sukchan, you wanted it on your left side. So, Minister's going to face forward.
Face forward.
Wonderful. And I'll let Ms. Sukchan do her thing.
Okay. So this is why I came in short sleeves this morning, so I could be vaccinated. So I have been immunized against the influenza virus, 2 strains of influenza A, 2 strains of influenza B. I think I have to wait 2 weeks for full immunity, Dr. Mohammed. 2 weeks for full immunity. Yeah? So ladies and gentlemen, the influenza vaccine is available at your health centers. We will be alerting you again that this is available. Please ensure that, as in the past 2 years, we have had no deaths due to influenza. Let's continue that trend. Get vaccinated. Again, don't delay. Get vaccinated. Thank you very much.
This is TTT. Live for local.
Good evening, I'm DK Roster. Welcome back to the TTT News. When we speak about the SDGs or Sustainable Development Goals, a government official may often come to mind. So we are trying to connect the dots to NGOs and civil society organizations already on the ground doing work that directly ties into the SDGs. We begin this conversation with the Caribbean Natural Resources Institute, or CANARI. They aim to facilitate effective